Thank you for joining us. My name is Ken Hekman, and this is Module 2 of 15 in 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are going to lead you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 2 of 15. Today, we are going to explore leadership, and the first function of leadership is scanning. Leaders need to understand what their community is asking of them, and scanning is the first step to understanding those expectations. So let's take a look at the learning objectives for this module. At the end of this session, we hope that you will be able to conduct internal and external needs assessments, be able to identify market changes that will impact decisions in your healthcare organization, identify sources of information to guide the adoption of best practices in healthcare management, and recognize the relationship between self-management and leadership effectiveness in the healthcare organization.
There are 2 kinds of needs assessments leaders need to conduct. First, they need to look at what the community needs and expects of the hospital or healthcare organization. We call this the external needs assessment. Second, leaders need to assess what's going on inside the organization. We call that an internal needs assessment. Let's look at some of the questions you can use to begin to assess the needs that your hospital or clinic can fill.
A good place to begin is to ask, what is the community asking of us? Hospitals, clinics, and other healthcare organizations don't exist for the benefit of physicians, nurses, and healthcare workers. They exist for the benefit of patients and their families. They exist for the benefit of their larger community. Healthcare leaders need to listen, first of all, to the expectations of their community.
In most communities, people have choices about where they're going to seek healthcare services. So the next question they will have on their minds is, how is your hospital different from others? What reasons are you giving people to choose to come to your hospital or clinic, rather than another hospital or clinic that is within reach? As mobility increases, so do patient choices. Like it or not, you are competing with other healthcare organizations for the right to serve patients. They will want to know why they should choose your institution.
Once you have explored the external needs, you can turn your attention to internal needs, beginning with the question, what is our capacity to meet current and future community needs? You can also anticipate changes by asking, what barriers will we need to overcome as we grow? Your goal with both external and internal needs assessments is to identify the gaps between your current levels of service and anticipated future levels of service. Then you can begin the process of closing the gap by changing both the scope of your services and your capacity to meet or exceed people's expectations.
You can conduct external and internal needs assessments by assembling your managers, supervisors, and team leaders for a half-day or full-day discussion. You may want to include a few community members, such as members of a governing board or committee, to provide additional perspectives from outside your staff.
To begin your external needs assessment, first identify different groups of customers your organization must serve. The most obvious group, of course, will be patients, but you must also consider the needs of family members of patients. Their needs may be quite different from the needs of patients. A third group to consider consists of those who are in an ownership or controlling position over your hospital, clinic, or healthcare organization. The owners might be government officials if you are a public institution, or they might be donors or private investors for a nonprofit or private healthcare organization. The next group you should consider is composed of people in the community who may not have used your services in the past, but might be considered future patients. Their needs and expectations could be quite different from those of current patients. Ignoring those differences will limit your potential for growth. Paying attention to those different needs can drive your growth and development. And then finally, you should assess the needs and expectations of your staff. Healthcare services are an intensely human service. You must depend on competent, talented, and engaged healthcare workers. Let your external assessment include an evaluation of the needs of current and future staff.
A common tool that leaders use to conduct an internal needs assessment is called a SWOT analysis. SWOT stands for strengths, weaknesses, opportunities, and threats. You can use this tool to periodically document key issues that can impact your operational performance or potential for growth. Spending as little as 1 hour with your management team can yield excellent insights to help you move forward.
Let's take a closer look at how you can identify market changes that are likely to impact your organization. We call external changes market forces because they can impact your organization's ability to provide or sell its services. These market forces may be well beyond the traditional understanding of healthcare services. For example, to plan well, you need to understand changes in the demographic structure of your community. You will need to recognize the impact of birth rates, migration patterns, death rates, and the age and gender structure of the community you serve. You will also benefit from observing what competitor organizations are doing that might impact your future ability to grow. Healthcare delivery has been impacted extensively by technology gains in the past several decades. Likewise, we have seen major changes in the healthcare workforce that will shape your capacity for service. Finally, environmental changes can have an impact on disease patterns, such as pulmonary diseases in the face of chronic pollution, that healthcare leaders need to take into consideration.
With each market trend, we recommend that you begin with factual information that you can gather through public and private sources. Develop charts and graphs that will help you understand the factual trends. But don't stop there. After scanning for the hard trends, consider the implications of those trends, which we sometimes call soft trends. For example, if you observe increasing birth rates, you can anticipate a growing demand for maternity and pediatric services. If you note that your 3 oldest competitors are all building a new facility, you can anticipate a decline in your services unless there are compelling reasons for patients to prefer coming to you.
Changing expectations may be much more difficult to measure objectively, but effective leaders recognize the value of paying attention to both objective and subjective observations. Major market changes rarely happen suddenly. Markets can shift with subtle, small changes that can hint of larger changes that may lie ahead. Online retailers like Amazon, for example, have significantly impacted retail stores in every sector. It took several years for consumers to get comfortable ordering products online, but the impact on traditional storefront retailers is now unmistakable. Healthcare leaders need to pay attention to both hard trends and soft trends, both objective measurements and subjective implications of changes in their community and in the healthcare sector to be able to effectively plan for the future.
Leaders can also look to best practices in healthcare management as resources for improving performance. Best practices are typically management tools or behavioral patterns that other healthcare leaders have found to be effective in their organizations. Leaders can shorten their learning curve by examining these best practices and discerning the benefit of adopting them within the hospital, clinic, or healthcare organization.
You can look for best practices through researching the internet, examining resources from relevant professional associations, and by following industry leaders in healthcare. If leaders are to be effective change agents, they must continually stay abreast of changes in the healthcare industry, in management, in leadership practices, and in the community as a whole. Reading books and journals is a great way to learn new ideas. You can also attend conferences and network with colleagues who face similar challenges. Social media, such as LinkedIn, now make it possible to network globally, extending leaders' capacity for continuous professional development.
Effective leaders recognize the value of scanning the external market forces and internal dynamics impacting the healthcare organization. But they also recognize the value of knowing themselves. If you want to effectively manage others, you must first manage yourself. It is critical that wise leaders scan themselves to know their personal values, their strengths, limitations, and character. My father once advised me to surround myself with people that had talents to complement mine. It is better to build a team with complementary talents rather than the same talents. Otherwise, you will simply think and act in similar patterns, limiting your ability to build on each other's strengths.
Think about well-known leaders around the world. How does our admiration of them reflect their self-awareness, their self-management, and their character? Those that we most admire have typically demonstrated sound character. Those we consider most notorious demonstrate limitations in self-awareness and character. We learn about leadership by observing those in positions of power and influence. Likewise, your staff and your community will make judgments about your capacity to lead on the basis of your self-awareness, your character, and your behavior. We telegraph our basic character through our behavior, so take the time to reflect, to know yourself, to prepare and improve your readiness to lead.
To assess yourself, consider your strengths, values, character, and limitations. Take inventories of each of these qualities so you can discern how to improve your strengths and manage your limitations. The Johari window can be an effective tool for helping us to assess ourselves. Developed by Joe Luft and Harry Ingham in the early 1950s, the Johari window begins with a model of a 4-pane glass window. One pane reflects what we know about ourselves and what others know about us. It is open. It is our open, public, or transparent window pane. But there are some things that we know about ourselves that others do not know. That is our hidden secret or closed window pane. Likewise, there are some things that others know about us that we don't know about ourselves. We sometimes call those our blind spots, and they can often get us in trouble. The fourth segment is known neither to ourselves or to others, and it is the unknown or the unconscious.
To increase your leadership effectiveness, your goal should be to increase the open and transparent portion of yourself. You can do that by disclosing hidden factors or qualities about your personality. You can also increase your openness by asking for feedback about your blind spots. Effective leaders look for the right balance of disclosure and feedback to increase their transparency. Increasing transparency builds trust, which may be the effective leader's most valuable personal characteristic. In my own experience as a healthcare leader and as a coach to other healthcare leaders, I believe I have grown tremendously in my effectiveness through introspection and reflection. I am an avid reader, but I also periodically keep a journal of my reflections about what I'm reading, learning, experiencing, and feeling. It is this inner life that, I believe, has been a distinguishing quality of my leadership effectiveness.
Psychologists and human resource professionals have developed a wide variety of tools to help people become more self-aware. Some of the more common tools are the Myers-Briggs Type Indicator, the DISC Profile, the Kolbe Index, Strengths Finder, and Predictive Index. You can learn more about these tools and others like them through internet research. Let's conclude this module by asking some common questions about scanning. People are constantly changing. So Ken, how can we really know what the community is expecting of us?
It is precisely because change is constant that we need to continually be aware of how the community is changing their expectations of us. We recommend that every healthcare organization conduct patient satisfaction surveys on a regular basis to identify changing expectations and to pinpoint service problems. We also think it is wise to periodically ask people in the community what they think about your hospital, clinic, or healthcare organization. Demonstrate respect for their opinions by asking for them and acting on them. We are not very good at reading people's minds, so there is no substitute for asking for their opinions.
Ken, how relevant are best practices from another culture?
Best practices are generally derived from experience in mature markets. That is to say, Western countries are more likely to have identified best practices in healthcare organizations because they have learned how to compete effectively and remain relevant under challenging conditions. If you are not in a highly developed Western country, you may find so-called best practices to be based on assumptions that are inaccurate in your own culture. You should not, however, dismiss them out of hand until you have discerned whether the experiences of others can teach you something. Glean the benefits of others' experience and then modify the lessons to fit your own culture in ways that improve services, increase quality, and enhance organizational performance.
If I'm already in a position of authority, why should I increase my self-awareness?
Leadership of a healthcare organization is a sacred trust. We earn the right to lead by virtue of our character, our talent, and our trustworthiness. We retain that right by the same qualities. Therefore, consider your position of authority as something that is perishable, like a carton of milk left outside a refrigerator. Leaders must nurture the qualities they rely on to lead effectively so they can continue to lead even as community expectations change, workforce challenges grow, and new technologies and ideas emerge. I hope you will be able to apply some of what you have learned today in this module to increase your effectiveness as a leader. Leadership begins by scanning external expectations, internal dynamics, and personal character. This sets the stage for the other qualities of leaders, enabling them to focus, to mobilize, and to inspire others toward greater performance. Thank you for listening. This concludes Module 2 of 15. For an exercise, we recommend that you assemble your management team and conduct an internal SWOT analysis.